have insurance a little bit higher. On average, everybody pays $1,000 per family in higher premiums to pay for other people. It's a tax, you just don't know it. And it's administered not through the government, but through your insurance premiums. So part of our goal is to make sure, A, that more people have basic coverage. B, that means that more people have preventive care. And if some of your clients have preventive care, I mean, you know this better than I do, then they're not coming in with diseases that could have been managed very early and much less expensively. I mean, diabetes is a classic example. The number of people who have diabetes because they're grossly overweight, they didn't catch it fast enough, they haven't changed their eating habits, and that had they gotten some effective care on the front end, could have avoided it entirely, is astronomical. It adds huge amounts of money to our health care bill overall. So we want to emphasize prevention. We want to give people more options in terms of being able to be covered in the first place. And then we also have to make sure that Medicaid and Medicare doctors and providers are effectively reimbursed. And frankly, what's happened historically is when states or the federal government run short on money, what they do is they just say, well, you know what, we'll just pay 70% or 60% of what the costs are, and we'll make the providers figure it out. And as a consequence, you got more and more providers who are not taking Medicaid patients. And if we don't fix the reimbursement formula for Medicare, you're going to have a bunch of doctors and hospitals who are going to start declining Medicare patients too, which is a scary proposition. So that's it. Now, keep in mind that's expensive. And so part of what health reform is about is figuring out how can we make sure that every provider gets every dollar that they need for quality care that they are providing. On the other hand, let's make sure that the care that's actually being provided is improving the health of the patients as opposed to just being a hidden way for providers to get more money. And what I mean by that is, let me, and I don't want to get too technical here, but I'll try to give you a simple example. It turns out that there are a lot of tests that are done that probably aren't needed, but because the system's so efficient, and because providers get reimbursed for a lot of these tests, that we're probably paying more than we should just on testing that doesn't improve the quality of care. And part of the Health Reform Act is going to have doctors and medical experts say, what's the best way to care for a patient with a particular ailment? And let's start reimbursing doctors for the overall outcome as opposed to the number of procedures that they're doing. That way, it may turn out we'll have fewer procedures, but overall a better outcome. And providers will get full reimbursement for those things that are effective. They may not get reimbursement for things that have been shown to be less effective. Now, all these changes are not going to happen overnight. They're going to take some time because this system has been such a mess for such a long time that making it more rational is something that'll take several years. But I'm optimistic we can do it. And I appreciate the great work that you're doing. So tell everybody, all your coworkers, help's on the way. This has been a terrific conversation. I want to close just by telling you something that happened this week that was, I think, the highlight of my week. I had we hosted the first White House Science Fair at the White House because we realized, when the Lakers win the NBA championship, we have them over to the White House, and when the Alabama Crimson Tide wins the national championship, we have them over to the White House. And when these incredible young people are winning international science competitions, or participating in these national competitions, nobody's acknowledging them. And that's sending the wrong message about what's going to be the most important thing to allow us to compete into the future. So we had this national science competition, and a select group of them set up displays in the stateroom in the White House. And it was unbelievable watching these kids. I mean, you had a young woman who had designed a energy efficient car and had a scale model that was made out of some material that I had never heard of before. You had a group from Tennessee that had designed this water purification system that was self-generating through a water wheel, and the whole thing was only about yay big, but it could provide filtered water for 60 families very cheaply. These are all high school kids, by the way. You had this a couple of this Latino kids who had designed this chair for doing therapy for people who are disabled, that they had designed from scratch because they had seen a friend of theirs who was disabled and not had the equipment that he needed. And they didn't have a lot of money in the school, so they actually sold tamales to finance this project. First time they had ever been on a plane was actually to fly to the competition, and that they ended up doing so well on. And then the last person I met, and there were others who were doing unbelievable stuff, but the last young woman I met, she was 16 years old. In her freshman year, she had taken biology, had gotten interested in the life sciences, was particularly interested in cancer treatment. So she decided between her freshman and sophomore year to teach herself chemistry in the summer, because she was so anxious to get started on learning more about cancer treatments. And she decided as a science project to try to invent a new cancer drug. Because right now there are clinical trials and experimental close to the surface. So she literally designed a new drug, won the international science competition, and now is being contacted by all these laboratories around the world who are working on these types of drugs. She's very smart. She's 16 years old. She hasn't graduated from high school yet. Here's the point. When you talk to these young people, you felt so optimistic about America. You felt like there's nothing that can stop us if we can just harness that energy and that ingenuity, and if we're investing in those kids and we're giving them a chance and they're able to start their own businesses and their own engineering firms, and if they're in the classroom teaching younger kids to that same sense of wonder and excitement, there's nothing we can't do. And I think that's important to remember, because we've gone through a very difficult time over the last couple of years. But there are kids like that all across the country. And if we create the right conditions for them, they will make sure that the 21st century is the American century, just like the 20th was. Thank you so much, everybody. Appreciate you.